Patient lives in Taiwan, and his daughter lives in Dallas, Texas in USA. His daughter brought his father's picture because his father has Hepatitis C since his his age of 60s. Now he is 82 years old. Yes. Yeah, he will be 82 years old in May. And he has been infected by Hepatitis C, and he has dementia. And so that's why she brought her father's picture. I found he had several other kinds of hepatitis, not only C, very many complicated and very many other kinds. And I also found the dots, the yellow dots are all brain cell death locations. So I put dots on top of his entire brain, and that's why I think he developed the dementia. So yellow dot indicates the entire brain cell death. And he has several kind of red dots in the body. Actually, his brain frequency test says they are all the cancers. Red dots are cancers. And all the green dots, they are all kinds of hepatitis. He does not only have the hepatitis C, but he has also all different kind advanced and complicated hepatitis. The first thing that I found was hepatitis F. So I found hepatitis F first. And it is all tested by his brain's frequency. Now, second one that I found was the most horrible hepatitis D. Nowadays, hepatitis C is the most horrible hepatitis, but hepatitis D is the most horrible hepatitis, and we can nickname it, this hepatitis C as hell kind hepatitis, the most tough and the horrible hepatitis, and he has it. The other thing is the hepatitis C, and it is already found by the hospital when he was around 60 years old. And it was the deepest infected hepatitis. The next one was hepatitis F and hepatitis C mutants. So since he has hepatitis F and hepatitis C, these mutants could be mutated inside of his body. Anyway, it is different kind of germ from hepatitis F or C. So it is independent mutants of hepatitis. So F and C mutants. The next one is hepatitis F and hepatitis H mutants. I did not find hepatitis H in his own body. It means he got infected by those two mutants from outside. So hepatitis F and hepatitis C already has been mutated outside of his body, and he got infected of these mutants directly. The next one was hepatitis Q. For my practice experience, I found up to hepatitis H, but this patient has hepatitis Q itself and the mutant with hepatitis I. But this patient does not have hepatitis I, but he has hepatitis Q individually and the mutants with I. And actually, I was so shocked because hepatitis got varied to Q so far. Now, I found all kinds of germs that got variated from the blood built at the conception self. Means his father's sperm and his mother's egg met and he got actually conceived. From that time, he developed lots of germs, and I found all those germs by his brain frequency reading. The other one is all current kinds of germs by the air pollutions. Nowadays, lots of pollutions in the air, especially the South Pole glacier got collapsed, and all those spores evaporates, and they are carried by the winds. So that's all I had, and also, since he has a lot of cancers, these are the one that I will treat. Before the treatment, I'm gonna test all those dotted area without anything and without any treatment. So first, I'm gonna test all brain cell death. So there's no biological rhythm movement happens. It means this little pendulum, the little instrument or tool to test if this cell has good biorhythm or not. But these are all blocked. And I found there are a lot of cell death in the brain, entire brain cell death. That's why he is found as dementia. Okay, now I'm gonna test all the cancers. It seems like they are lung area. And I think it is abdominal area and probably ureters or prostate area. So all the red dots are the cancer sites. Now all the greens, they are all kinds of hepatitis infected area. So none of any area has the right biorhythm frequency. It means he has disorders. Now I'm going to treat by the quantum frequency phenomena. Quantum frequency means in the world every particles or every substances have their own frequencies. And it has all exactly same kind of characteristic of their original quantum. So frequency carries the quantums, all kinds of characteristic, and we call this phenomena as quantum physics or quantum frequency theory. And it is really existing. Since this patient's picture is exactly same looking of his real being, this picture carries his own frequency. That's how I could determine by the frequency reading. At the same time, the treatment can be done on this picture pattern. Then the treatment frequency can be transmitted into his real body. That's how I can treat the patient by the picture. So I really hope whoever watches this video, it is not shamanism. It is not magic. It is the physics, very high-level physics, and we call it quantum physics or quantum frequency theory or quantum frequency phenomena. So please don't think this is shamanism. It is very high-level physics. So after we turn it off, I'm gonna start the treatment.